All right, good morning, good afternoon again. Thank you all for logging on to today's conversation. My name is Sean Santana. I'm part of the communications team here at Carbon Health. Thank you again for taking the time to be part of this conversation on the Delta variant. Of course, COVID continues to be top of mind for lots of folks, and the Delta variant has just thrown another wrench into this whole mess. So hopefully we'll bring you some peace of mind and a little more clarity after our conversation today. Before we get started, I'm going to go ahead and run through a couple housekeeping items. This is a webinar. Webinar is being recorded. You will receive an email with the recording after the webinar. You might also notice that all attendees are in listen-only mode. So you may ask questions in the Zoom Q&A panel. So don't use the chat box. You're going to actually see a button near the bottom of your screen that says Q&A. Go ahead and use that button. You can submit questions. You can submit them anonymously if you mark anonymous there when you submit that question. And on the topic of questions, please do ask them. This session was created specifically for you. So if you've got any questions, there are probably lots of other people who've got that same question. So please don't be afraid to ask away. So we'll go ahead and get started by meeting our panelists. We're going to start with Dr. Aaliya Yaqub.
Hi, I'm Dr. Aaliya Yaqub. I'm a board certified internist and the medical director of enterprise and strategic partnerships here at Carbon Health. I work with our enterprise customers very closely and do medical consultations. Some of my passions include staying up to date on COVID and what's happening with the Delta variant, and then also preventive health and wellness.
Hello, everyone. I am Dr. Curry-Winchell, and I go by Dr. BCW. I am the Regional Director for Nevada with Carbon Health. I am a board-certified family medicine doctor who practices urgent care as well as community health medicine. I am passionate and dedicated about health inequities, disparities, and really just shining a light on, COVID-19 and what we can do to really provide more information to our communities. And I am excited to be here. So first, I want to start with Carbon Health. And first and foremost, thank you for having us. Carbon Health is a technology-enabled healthcare provider that combines smart technology with modern clinics. Carbon Health specializes in urgent care, primary care, as well as mental health. And as we know, especially during this time, it is so important that we really invest not only in people's physical or overall health. It's also important that we are thoughtful and mindful and really considering people's mental health as well. Our mission is to make high quality healthcare accessible to everyone. We are growing. It's very exciting that we are now in more than 75 locations and growing each week. We are offering virtual care in most of the US. So this is the exciting part that I am so excited to share with everyone. When we talk about Carbon Health and the investment that Carbon has really provided within, communities across the US, it's important that we mention that more than 1.5 million vaccinations have been provided from Carbon Health. And so that is an amazing hurdle that Carbon has taken on and done with such compassion, and also the ability to really take in inequities and disparities and really make a difference in communities across the US. We have provided over 1.5 million COVID tests as well. And we've partnered with local governments to focus on equitable vaccine distribution. And we are leaders in COVID-19 information. And so we are so excited to be here to really talk about, what's happening across the US with COVID, as well as answer your questions. So we are going to get started and really do a deep dive into your questions, your concerns, and how we can help moving forward.
All right. So, like Dr. Curry-Winchell mentioned, we do have some questions that were prepared ahead of time. We're going to dive into those, but please do submit those questions. Remember, you can use the Q&A feature at the bottom of your screen, and feel free to check off that anonymous button. So don't be afraid to ask any questions. We are absolutely here to try to get you some answers, or at least the best advice that we can. So let's get started. The first question we have here. So I do recall myself early on, we were already hearing about variants of COVID. And it seems like Delta has certainly stood out from the crowd, if you will. So one might start to wonder, how is Delta different from every other COVID-19 strain?
I can take this one. So with the COVID-19 virus, we know that it's actually a simple virus. It has, very few proteins. The way that viruses enter our cells is they have these like sort of spike proteins on the exterior of them, and that helps them with transmission. And so what basically happened is Delta is a variant that had a mutation in one of those spike proteins, and it made it much more transmissible. So Delta gets transmitted in humans much more rapidly and easily than the previous Alpha strain and some of the other strains that were circulating. There are also, potential for additional mutations that can cause new variants. And we've seen that with the Lambda variant in Peru. And of course, our worst nightmare, honestly, would be to see a mutation that led to new organ systems being impacted by COVID. None of that has made itself a reality at this point, but I think the entire scientific community is keeping a close pulse on that situation and watching out for any new variants that develop and that propagate throughout any country in the US.
And I can add a little more information. When we talk about the Delta variant, it is highly contagious. And that really means, the more it's around and rampant throughout communities, it is causing, unfortunately, people to get sicker. And so often I hear the question, why should I really worry about all of these variants? And it's important to remember that viruses naturally mutate. That's what they are supposed to do. However, when you do not have a level of vaccination or the ability to really temper a virus, that's when it really starts to just kind of run, throughout communities. And so the Delta variant is really, unfortunately, it's making an impact in the younger population as well as the older. And because of that high contagious factor that I mentioned, people are getting sicker. Unfortunately, there is an uptick in hospitalizations and ICU, and unfortunately death.
Something you said just now, Dr. Curry-Winchell, actually stands out to me. As I watch the news, I would say, just in my own perspective, early on, we weren't hearing as much about younger people being infected, maybe folks in their 20s or 30s. There was a lot more attention on people maybe in their later years. So what exactly is playing into why more folks who are in that younger range, why are we seeing more infections in that age range?
So because the Delta variant is just a higher viral load, we are seeing, the younger population with less amount of exposure versus before it might have taken more time to really get sick or actually contract COVID-19. And so that, in addition to the softening of different mandates that we have, that has really allowed a combination of things to kind of allow Delta variant to just run rampant. And so there's several factors that are causing this, but the younger population are definitely getting affected. And in the urgent care, I can share with you, I am seeing that age group, from about 15 to age 40. And it's important that we remind ourselves, in the beginning of the pandemic, we heard about underlying health conditions, and that was often associated with those who were, being admitted or unfortunately having to be in the ICU. And now we are admitting patients that do not have any underlying health conditions. And so they are younger, they're sicker, and unfortunately, we're seeing an uptick in mortality.
Okay. Well, speaking of what we see in the news coverage, a lot of times we hear different types of metrics. We hear a lot about infections and hospitalizations, but we're also hearing about we're hearing this term breakthrough infections. So, what are breakthrough infections, and how serious are they, and why are we seeing so many?
Yeah, I can take that one. So a breakthrough infection is evidence of positivity on a COVID-19 test in somebody who is fully vaccinated. So basically it's, a positive case of COVID in somebody who's fully vaccinated is what we're calling breakthrough infections. And breakthrough infections make for really good headlines. So I'll start by saying that. So that's why we're hearing about them so much. The good news is that our vaccines, especially the mRNA vaccines, Pfizer and Moderna, are pretty effective at keeping keeping mortality and morbidity rates low. So basically keeping people out of the hospital and keeping people from dying, even if they do get COVID. So we obviously stress the importance of getting vaccinated, and it's still more important than ever. We're also talking about boosters. You're probably hearing about that in the media, which we'll probably touch upon a little bit later. But going back to breakthrough infections, we do know that there are a certain percentage of people who are getting breakthrough infections. And those infections, we don't know what the total percentage of those is, because some of them are asymptomatic, meaning that people have no symptoms and they are walking around just totally fine, but they actually have COVID and they're passing COVID in their communities asymptomatically. And then there are the folks who have breakthrough infections who are symptomatic. So they actually have the symptoms and they're the ones that are getting tested, and we're finding out that they actually have the breakthrough infection. So our breakthrough infection rates are really based on the people who are symptomatic and who got tested. And we really don't know how many people are walking around asymptomatic with the breakthrough infection. So the general answer overall is we don't quite have all the information that we need to give you a percentage of how many breakthrough infections are occurring. But we do know that vaccination is very effective in protecting the person who has the breakthrough infection. Now, the question is, all of the sort of state mandates and local jurisdiction mandates that still require masking and social distancing, those measures are really, really important sort of in combating the spread of COVID, given that we know that breakthrough infections can happen.
And it's really important. I often hear the question, well, if I can still get COVID, why should I get vaccinated? And so, just as Dr. Aaliya mentioned, it is a layer of protection in hopes that you do not, end up hospitalized or in the ICU. And so it's really important to think about what it can prevent, not only for yourself, but your family. And so although, the breakthrough infections, just as she mentioned, are really, those media hits that people like to talk about, we forget how many people are actually protected from being hospitalized or other family members actually contracting COVID-19. And that's really important to, consider. The other thing I always like to mention, as she stated, all the measures of mask and hand washing. And I always like to reiterate, hand washing was important before the pandemic. And so it's important now. And so, sometimes people are like, oh, all of these measures, but if we take a step back and we think about the things that, we have done in the past to really help mitigate different viruses and outbreaks, we can move forward if we can actually adopt it. So getting vaccinated truly is a level of protection.
That's actually kind of a perfect jumping off point for our next question on the topic of protective measures. A lot of people, as we start to return to public life in maybe a limited capacity, and we start to breathe a little, feel more relaxed, and maybe let our guard down. Some people, again, may be fatigued when it comes to wearing a mask. And some people kind of saw getting the vaccine as the all right, this is my pass, right? I don't have to deal with that anymore. Throw the masks out. But that's not the reality. So the question that we want to answer, and you kind of touched on this, so maybe we can expand, is if I'm vaccinated, why do I continue to wear a mask?
I can let you take this.
All right. That is a great question because, those of us who have stated we're vaccinated, why do we have to continue with these measures? So it's really important to look at, where you live and how many people are actually positive. And so if you have a high level of positivity, although you're vaccinated, it's protective, but the virus is so available and rampant that it really increases your chance of actually contracting COVID-19. And so that's what I like to kind of circle back to. The fact that we haven't reached a level of true, immunity with people actually getting vaccinated, we are really trying to tackle this virus and the variants. And so although wearing a mask can be cumbersome and it's hard if you have little ones, I have a couple of kids and it's hard to get them to wear it, it's an additional layer of protection. And so I'm hopeful that in the next month or two that hopefully we can take that off. But until then, being vaccinated, wearing a mask, and hand washing really is your best chance of not contracting COVID-19 or spreading it to others. And I think that is the most important thing to think about, not just ourselves, but others.
That component of safeguarding those around you, that's what really resonates with me as an individual. So we always want to keep that in perspective. We are starting to see some questions come in, which is great. So again, I want to encourage anyone listening in today to go ahead and use that Q&A feature. We'll do one more question from our list, then we'll pop over to the questions that were coming in. So go ahead and get those in now. Again, that anonymous feature is there as well if you don't want to submit them along with your name. But this is a safe space. So. Okay, so something we touched on a little bit earlier, very much in the news this week is boosters. So we've got a few different questions about boosters, so we'll kind of take a few at a time. But first off, what is the latest with boosters, and when will they get approved beyond what we've seen so far?
So that's a tricky question because I think we're all sort of on the edge of our seats trying to hear about what the scientific community is recommending. And it's a little bit unclear still. So what we had, I think it was last week, was messaging out of the White House directly saying that a third shot or a booster would be available to all Americans starting September 20th. However, what we know is usually the CDC is the organization that sends out that messaging, and they haven't really done that yet, except for sort of recommending booster or a third shot actually for the immunocompromised. So that's specifically folks like those who are on immunosuppressive drugs, folks who have severe HIV, those who recently had a bone marrow transplant, those types of folks who really are at risk right now. We were sort of suspecting that folks 65 and over might be eligible soon for a booster. However, that hasn't materialized just yet from the CDC's recommendations or certain counties like LA County, which usually are kind of at the forefront of some of the more conservative measures in sort of reducing caseloads in the county. And so, it's still a little bit TBD or to be determined, I would say, but I think that boosters are in our near future. And it's just a matter of ironing out who exactly gets them, in what order, and making sure that the most vulnerable folks are the ones getting them first. I forgot to mention that healthcare workers, essential workers are at the top of that list as well. So I think they'll be getting them before anybody else as well. Dr. BCW, any thoughts?
Yes, I would like to add, the common question I get in clinic is, why do I have to have this booster? Why do I have to have another shot? And so I think it's important to remind ourselves that, in the past, for your tetanus, your flu shot, all of these other things that really have provided a layer of protection for years, it's common to, have a booster to help kind of continue that protection. And so although often people are like, I don't want to have a third shot, if you really embrace what that third shot could do for yourself and your family, that's really helpful in thinking, yes, I'm going to go ahead and move forward with it.
Yeah, and to sort of add on to that, what a booster really does is it boosts your immunity, as we know, but it increases your antibody levels. And so if you, let's say, got your COVID vaccine at the very beginning, which at this point is now 8 or 9 months ago, with the earliest folks kind of getting them in January, and your immunity is kind of decreasing and waning, then it makes sense to sort of boost it at this point, and continue to protect yourself against Delta, which we know is super transmissible.
And I think this is a good time to kind of talk about when we talk about boosters and just the overall, injection process. A lot of people were very concerned about what they call side effects that they really experience during the first shot or the second shot. And so I think this is a great time to explain what that means and really correlate with boosters. So often we hear about, fever, body aches, and so forth that occur after your first or second shot. Well, as Dr. Leah mentioned, that is your body's way of really arming itself if it was to ever to come into contact with COVID-19. And so the way to generate antibodies when you are feeling maybe fatigue or fever after that injection, it's your body's way of protecting itself. And so I like to call it a dress rehearsal, because I think that's a nice way to kind of think about it. If you like sports or other things, you can think of it as a practice. And so when you are prepared for that possible dress rehearsal, it really helps you kind of embrace and understand why your body is reacting that way. And I hope by sharing that information, if anyone is hesitant to get a booster because of the side effects that they experience over the first and second shot, I hope this helps you kind of make a decision to get that booster when you're eligible.
I think that is an excellent way of looking at it. Thank you so much for sharing that kind of analogy of a dress rehearsal, or this is just your body hitting the field for that. Gosh, what is the sports term? A scrimmage? Does that sound
Yes,
right?
it's practice scrimmage. And when I've done talks in the past, it's really important to kind of find a way to, what's a good example that you can really understand that's tangible to kind of feel like, okay, this is all right. I know what's about to happen.
Okay, so a little bit more on the booster. So, Aaliya, earlier you talked a little bit about some of the folks who we expect may be some of the first groups to receive a booster when that time comes. And it kind of echoed what we saw when vaccinations were first coming out. We heard about immunocompromised populations, we heard about healthcare workers, and maybe folks in later years in life. But for the rest of us who are listening, and maybe we don't hear ourselves in those groups, how is there any way for us to anticipate? Can we get a sense of, will we need one? And is there any way of anticipating when that'll be available to us?
Yeah, I suspect that we will all be needing a booster. That's sort of the direction that the research is suggesting in terms of our immunity. And, in terms of exactly when the rollout of that happens and how it happens, we don't have the exact details of that yet. If I were to ponder a guess, I would say that sort of in the later winter months, we'll start hearing about sort of a mass rollout of that, of those booster shots. And I suspect that you'll be able to get them at your doctor's office, and it will be very different than when the initial vaccine rollout happened. There probably will be places publicly where you can get your booster as well, but they will probably be available in your doctor's office as well. And once they are available, they will for sure be available at Carbon Health.
Thank you so much. Okay, we're going to turn to our listener questions. So the first one asks, is there a place to review statistics or any sort of data showing hospitalization or death rates of vaccinated versus unvaccinated?
So there is a lot of data out there, and I would welcome Dr. BCW to chime in as well here. But I'll just give an example of in LA County, which I've been following very closely over the last year. Most recently, in the last 3 to 4 months, I would say there have been very minimal numbers of hospitalizations in vaccinated COVID positive people. So I think it was in July and August, there were 0 hospitalizations for folks who are COVID positive with a vaccine, who are fully vaccinated. And the vast majority, if not every single one of the cases that were hospitalized or experienced mortality were in people who were not vaccinated. So we know that it's overwhelmingly skewed in terms of the folks who are really suffering from COVID and experiencing hospitalization and even death are the folks who are not vaccinated. That is for sure across the United States, and all of the large academic centers where we're in touch with physicians and colleagues, we're hearing the same story over and over again. We can pull up the exact statistics as well, but in general, that's what we're seeing.
And so I can speak for Nevada. We have a similar kind of hospital association website that you can actually see the number of hospitalized patients for vaccinated versus unvaccinated. And one thing to really think about, because often people are like, I want to see those rates, which are very important metrics to look at. But we also have to think about the support staff, everybody that is involved in taking care of each patient. And so although the rate may not be super high for those who are, looking from afar, you think about how hard the healthcare workers are working to really, take care of all of those patients that are really at capacity for that hospital. The other thing to think about is when we talk about pediatric cases, most hospitals, unless it's a children's hospital, we don't have a lot of beds for the ICU for pediatric cases. And so if you have a high rate of hospitalization in pediatric patients, you are really strained to be able to have beds or capacity for those patients. So it's a mix, and often we focus on adult patients, but not really taking into consideration pediatric patients in the same hospital. So our numbers, especially here in Nevada, are definitely up overall, but it's the unvaccinated that are really the majority of our hospitalizations.
Yeah, and I would also just add to that in terms of the pediatric population or children, we are seeing higher rates of COVID cases and hospitalizations in places where people are less vaccinated. So the higher the vaccination sort of rates are, the lower the case counts amongst children, and the lower the hospitalization numbers amongst children. So the more vaccinated the population around you is, the less at risk children are.
And a question I often get, from my parents of patients, what can we do to protect our child? And that really speaks to the point of getting vaccinated, because your child may not be eligible, but if you are, that's going to really help, protect your child from getting COVID.
That's a great point. Again, when taking it back to doing what we can for the folks around us. Sometimes dealing with this pandemic that's been going on for beyond a year, you can start to feel a little helpless sometimes when you look at the people around you, look at those people that you care about, that you want to protect, and you say, gosh, I wish I could do something. This is it. This is what you can do. This is one of the parts, at least.
Absolutely.
Okay, so we did have a question come in regarding Delta and how it can spread among vaccinated populations. So the question is, should employers do weekly testing of vaccinated individuals?
I can take that because Carbon Health has an actual protocol that stays up to date with the latest research findings and what's happening out there in communities as well. And so we are recommending surveillance COVID testing once a week in vaccinated populations, given that breakthrough infections are still possible, and depending on the outside, the population outside of the office still being sort of not being fully vaccinated. So communities are not fully vaccinated for the most part throughout much of the United States. And so we are recommending that surveillance testing to catch those cases, those asymptomatic cases of COVID that are leading to further spread.
Okay, so on the topic of the workplace, again, going back to the idea of some communities maybe being more relaxed, welcoming folks back into public spaces, such as the workplace. What other types of precautions should we be taking in the workplace?
So in the workplace, we are recommending masking, still social distancing, hand washing, as Dr. BCW sort of touched upon, is super duper important as well. And of course, if somebody has an exposure to COVID, we do recommend that they sort of take precautions, test, make sure that, they're negative, and then test again 5 to 7 days later, because the incubation period for the Delta variant we know is about 4 to 5 days. And so it doesn't just show up right after you had your exposure, but can show up a few days later. And then if you're unvaccinated, we're recommending that you quarantine at home if you had an exposure, in addition to the testing.
And one added thing, I mean, I think even within employers and just like schools and different places, if your employer or, well, I guess if your employee is actually having any symptoms, really setting up a way where they can come forward and state, I'm not feeling well. I need to take the day off, because that is going to be another opportunity to decrease the spread. And so if that employee feels confident that they can really reach out and share that they're not feeling well, that's going to have a trickle down effect to your company, because it will mitigate or at least help, spread less to others.
Okay, so we've got a couple more questions here, and I think we've touched on this a little bit already. But if we want to expand upon it, we do have the question of under what circumstances should I get tested? I know we touched a little bit about, symptomatic or asymptomatic, vaccinated, unvaccinated. When do I get tested? When should I get tested?
Yeah, so I think testing should take place under certain circumstances. And then, of course, everyone has sort of their individual level of concern and threshold for wanting to get tested. But when it comes to travel, I think, for international travel to and from the United States, you should definitely get tested. That's obviously a requirement. If you have an exposure to somebody who has a known case of COVID, you should definitely get tested immediately, and then also a few days later, given that incubation period. And then, if you're having close contact with people whose vaccination status is unknown, or you work in an environment where, you have close contact with folks, that's sort of a time to think about regular testing every week, if possible, if not every 2 weeks, if you can't do every week. So those are some of the, I think, main circumstances under which you should get tested. And then, of course, if you exhibit any symptoms that could sound like COVID, you should get tested as well.
On the topic of symptoms, so at the beginning of this conversation, we actually talked about how Delta is different from other COVID-19 strains. So some people might be wondering, are the symptoms for Delta any different from before?
I can take that one. So one thing that we have noticed that, in the beginning with the initial strain of coronavirus, it was more, upper respiratory. And then a couple of months later, we noticed that patients were exhibiting diarrhea. And so we found that it actually, was really connecting to an enzyme that's in the colon and causing patients to have diarrhea about a day or two before the onset of upper respiratory symptoms. Now, with the Delta variant, just because of how highly transmissible it is, we have seen that it's back to that same type of presentation of upper respiratory, kind of a sinus infection, but not always associated with the fever as well as diarrhea. And so those are two common things that we're seeing. However, there's always those one-offs where some patients are just having a cough, or some patients are just stating, I feel really achy. So it's important, although, to have a template, not to feel like you have to adhere to it. So if you are feeling, anywhere near not your best self, I guess is the best way to say it, get tested, because, it's possible that you could have it.
Okay, so we've talked a lot today about making the right choice for ourselves, making the right choices for those around us, keeping ourselves safe. So if we're continuing to to do social distancing, or we're continuing to wash our hands and we're continuing to mask, maybe we're not interacting with other people as much, but we're still out in the world and we're touching things. We're touching surfaces, we're picking up things, we're grocery shopping, maybe picking up dinner. So one of the questions we received was, what is the likelihood of getting the virus through touching surfaces?
So the virus is primarily airborne, and you primarily get it from other humans. However, you can get it from touching surfaces if you're not washing your hands. So if you are touching surfaces and touching your nose, your eyes, or your mouth, and this is in particular very prevalent in children, because they, depending on their age, are touching all places on their face, they can definitely get it that way. So I think, hand washing, using hand sanitizer, and really taking those types of precautions really decreases the risk of something like that happening. And I know at the beginning of the pandemic, people were disinfecting everything, like their grocery and everything that they're touching, and disinfecting things just, very, very, very often, I would say, throughout the day, even if they weren't being touched. We're not doing that and recommending that as much. In shared spaces, we are still recommending wiping them down with a disinfectant, and continuing those types of measures. But the vast majority of people are getting COVID from other people, in unmasked situations, is how the vast majority of cases are being transmitted. We are also hearing about cases where if you're masked and the people around you are not masked, you are able to get COVID as well. So the best situation is where everyone is masked, ideally, especially in indoor spaces. But yeah, you can still get it from touching surfaces. I think it's not as big of a concern, given that we have hand washing and hand sanitizer and whatnot.
Okay, so we actually have one more question. So if anybody else has been waiting, maybe you wanted to see if the answer was questioned in the conversation and you want to make sure you get it in, I would say now is the time. So make sure that you go ahead and use that Q&A feature to ask your question. So we're going to ask the next question, which is, are there any good resources? Are there any good informational sites that we can direct individuals to who are nervous to receive the vaccination based on their personal circumstances? So earlier we talked about maybe hesitation, a lot of focus on these side effects that people may have been hearing about, but sometimes it's just something going on in their own situation, underlying conditions or fertility were listed as some of the examples here. Where can we point people who are maybe a little anxious based on their own situation?
Do you want to take this one, Dr. Bayo?
I can take this. Well, at least in Nevada, and this is a site that you can definitely explore, Immunize Nevada has a amazing catalog of different questions that may actually answer your own personal, concern with getting the vaccine. We have different doctors and healthcare providers and community members speaking to different topics, such as fertility and also historical mistrust. And I think that's an important thing that we need to highlight. And it's something that I'm passionate about. There are certain groups and so forth that really have a deep-rooted mistrust. And there's a reason why when we talk about public health. And so if you explore that site, you are going to see an amazing amount of information that really answers different questions, not only from the BIPOC community, so Black, Indigenous, people of color, as well as underserved, and just several different things that might be your answer. And if it doesn't, I encourage you to reach out to one of us, and we are happy to try to explore that for you in hopes that that helps you make the best decision for you and your family.
Yeah, I would say that vaccination is definitely our best defense mechanism against the spread of COVID. And as we know, COVID unfortunately is not going anywhere, despite the fact that we're burnt out from the pandemic and hearing about it, and it's emotionally exhausting and really taxing. It's not going anywhere, given that the vast majority of the world is unvaccinated, and the COVID virus, it has so many hosts to sort of transmit itself to across, sort of the globe. And so, really taking vaccination seriously and getting some proper education and counseling, if that makes you comfortable, I think is really important. Remember, your primary care provider is your partner and advocate in this. And if you have specific questions, they're the kind of the best person to reach out to. With regard to fertility concerns, this is something that I'm very passionate about in terms of educating folks about, the fact that vaccines are safe and don't impact male or female fertility. Is sort of an important issue that I think is a big issue for people because of the fear that surrounds that. The American College of Obstetrics and Gynecology is recommending vaccination for all pregnant women, all breastfeeding women as well. And, the American Society of Reproductive Medicine has put out some really good content on this, specifically talking about how the vaccines impact the placenta and have no impact on male or female fertility or fertility potential in the future as well. So I think there's a lot of good resources out there, but seek, help from your healthcare provider, I think, is sort of the first step in getting those, important things addressed.
I would agree. And a lot of people aren't aware that when the clinical trials were happening with this, with the vaccines, that participants actually did get pregnant inadvertently while participating in the trial, and there were no adverse outcomes with the child. So I think that's important to really, shine a light, as well as think about your risk factors being pregnant and contracting COVID-19, and the complications that can arise from that are a greater risk just overall. And we know that the vaccine is protective, not only for you and your baby, that it's important to really look at the benefits of the vaccine if you are trying to get pregnant or if you are pregnant, because it really can provide a layer of protection.
That is so interesting. I'm really glad you brought that up because I had not heard it. I know there was a lot of talk in the news about who would be included in trials, and there was maybe some hesitation around including pregnant individuals. So to hear that folks who were involved and then just happened to become pregnant, it's awesome that now we have some information that we weren't even expecting to get out of it, but I know that people are looking for. Okay, so we do have another question, and the individual says, my work site is planning on returning to work at full capacity in a few weeks. What's the guidance on this?
Yeah, so, in terms of return to the workplace, I think there are a lot of issues to sort of unpack here. I think people have a lot of anxiety about going back to work, given that we've sort of been in this state where everybody's been working from home, and some folks have really taken a liking to that. So I think there's sort of the mental health component of returning to work. And then there's actual safety and measures that are being taken to protect people from the spread of COVID. So some workplaces have taken the stance of mandating vaccination. So that's sort of one thing that we've seen very commonly. Others have reduced capacity and have implemented surveillance testing and masking and social distancing and disinfecting, and sort of like this whole protocol to protect employees from the spread of COVID. And then, it really just depends on your employer and what sort of precautions they're taking. I think if you're having hesitations or you're concerned, I'd reach out to sort of your HR manager and just check in and see what sort of precautions are being taken. And then if you feel like you want to get your own COVID testing, I think that's also an option to keep your family safe, depending on what your circumstances are.
Okay. Well, we have arrived at the end of our questions. That's everything that came in. I do want to say if there was a question that you didn't squeeze in, you can always direct those to your customer success representative. So they are a resource to you. But we'll go ahead and end the conversation here. Any last thoughts you would like to add, Aaliya or Bayo?
Yeah, I guess I would just say, I know it's hard trying to stay up to date with all of what's happening with COVID and with Delta, and just make sure to take care of your mental health and take the space to get your concerns addressed if you're not sure about the vaccine or if you're sort of on the fence. My strong recommendation would be to get the vaccine because the benefits definitely outweigh the risks. And there have been so many cases of people, unfortunately, who, sort of in the ICU were very regretful about not getting the vaccine and, were consuming media or were, believing in misinformation. And so I think, if there's any way for you to get more informed about it, we're happy to share resources, but we highly recommend that folks get vaccinated just to protect our communities and yourself and your own family.
And I just want to say first, thank you for having us and the opportunity to discuss this important topic. And this is the first step in really, not only educating your employees, but yourself and others. And so, as Dr. Aaliya mentioned, take the time to inform yourself, really find that trusted messenger because there is so much misinformation out there. And it's unfortunate that some people have actually, felt that, oh, this vaccine isn't for me, and then have succumbed to COVID or currently hospitalized. And you don't want to be in that position. You want to be in a position where you can be in the best protective arena as possible. And that is through getting vaccinated. You will protect yourself, you will protect others, your family members, and having the opportunity to really share information that's trusted is so valuable. So please take forward the health information that you've learned from us and spread it forward because that's really going to help us, overall make headway or change in combating COVID-19. Thank you for having us.
All right. Well, thank you. Thank you both, Dr. Curry-Winchell and Dr. Yaqub, and thank you to all of you listening in today. We hope you've walked away again with more information, a little more peace of mind, and enjoy the rest of your day.
Bye. Bye. Thank you.